was not part of this age group. But now, all of us are part of this age group. So if I were to write this paper today, I would remove this concept of presbyopia, and so I'd just say, delayed youth. But anyway, what's important about this, what I want to discuss with you today, is what I find very interesting about this paper and useful is this is a paper that even though it's been written a while ago, it's very helpful to use when you're approaching your patient in this age group and sort of give them the expectations that they'll what to expect in regards to retreatments, in regards to visual potential of improvement, and what to expect so that you have more of a realistic expectation in what you're going to deliver in this particular population. And also talk about safety, of course, efficacy, and predictability in this age group. So we assume LASIK is a procedure only for young people, but as you all know, 40 is the new 20, I think. At least I like to think about it that way. And so on. So therefore, this is a greater amount of patients that are now going to refractive surgery, specifically LASIK, in the age group between 40 and 50 and 60 and so on. So again, this is a paper that was retrospective, comparative, and contemporary case series. A significant amount of eyes were done here, 710 eyes of 424 patients within the age between 40 and 69 years who had LASIK. Patients had manifest refraction, spherical errors ranging from minus 10.5 diopters to plus 6 diopters, so it took the whole gamut from high myopes to moderate hyperopes. And patients were divided in 3 groups, and this is what gave us the information that we really want to know about. Patients group 1 was the group between 40 and 49 years old. It's my group now. Group 2, patients between 50 and 59. And group 3, 60 to 69 years old. This group, as you see, this is what the demographics here, and you see that it's well divided between patients that are group 1, group 2, group 3, and also the hyperopic group and the myopic group. So, of course, in a patient population like this, you're going to offer the patient the ability to see distance, but also offer them the opportunity to see it near, and therefore the discussion about monovision, which is very important here, is one that's discussed with the patients here. And therefore, the patients that were myopic, with a refractive error with 2.5 diopters or less of myopic, who are willing to accept monovision, then these patients had the dominant eye operated on and then the non-dominant eye left alone. The presbyopes with myopia were greater than 2.5 diopters, or with hyperopia of both eyes, these patients were going to have the choice of having the dominant eye corrected for distance and then the non-dominant eye corrected for near, depending on their interest in regards to what they wanted to achieve, either near vision, intermediate, and that was adjusted according to the patient's needs. So, sort of, also what I think is important here in this slide is sort of your guide here. Your patients from 40 to 4 years old, near was adjusted between minus 0.5 to minus 1 diopters. 45 to 48 years old, the near was adjusted to be between minus 1 to minus 1.25. And patients that had 49 to 43 years old, then the near was adjusted minus 1.25 to 1.5, and greater than 53, then the patients had the option to go between minus 1.5 to 1.75. And I guess the slide is a little bit, I can't see it well from here, but you see the recurrence rates are significant here. Not significant. There's a trend to higher recurrence rates in the different groups here, which is something that you have to bring up to your patients within the range of, say, 15 and above % of recurrence rates. So that's something you have to discuss with your patients as far as monovision between the group 1, group 2, and group 3. So that's one important information you have preoperatively with the patients as far as expectations that they might have a retreatment. So visualize the retreatment in myopic patients in particular. Then here you see as you go below here, group 1, group 2, and group 3, the recurrence rates. This is the presbyopia. I got to see it here.
Yeah, I did the same thing.
17. See, I'm definitely group 1 now. But see, within the range of 15 to 20%. And this is what I think it's important to take out of this paper is the information that you have, that you provide your patients in studies like this that specifically target the presbyopic age group and what the expectation as far as the need for retreatment in these cases. So you're within the range of 15 to 20. Again, none of these are significant in your statistics, but there is a trend that you have to then discuss with the patients as far as expectations. And then the hyperopic group also has in that range of the SARS retreatment rate. So these are numbers to sort of keep in mind when you have the discussion with your patient and the preoperative evaluation as far as expectations, so not just distance, but near, and also the outcomes over time. So this is a busy slide, but we'll go up about it as far as graphs. We're going to discuss then the efficacy, the predictability, and the safety of these particular cases. And you see here, as far as efficacy, what we see here is divided again between group 1, group 2, and group 3. Here, and you see here, then the slide, as you see here, we're talking about efficacy. We see the patients that achieve 320 or less, or better, I'm sorry, within the range of 50% or so. And as we go between the different groups between 20-25, there's a higher efficacy range, which is the 23 to 25% between the patients group 1 and group 2. But of course, as you go beyond that, then everybody reaches almost 100%. So in the hyper-OPC, it's sort of the same range, 40%, 70% at 2025 and beyond. So that's sort of the expectation as far as the patients that are presbyopic, myopic, or hyperopic, that the expectation is to be within the 2025 range or so. You're going to reach about 30% or so those ranges, and as you go higher to 2030, then you're reaching a higher group of patients in that regard. Now, as far as predictability, the patients that achieve within the 0.5 of the predicted or the intended correction, you see between 50 to 60% of the patients are achieving that goal. And once you reach within the range of 1 diopter, then you're pretty happy in regards to what you're going to achieve, 80 to 90% between the ranges of correction in patients in group 1, group 3, and group 3. And you see here, of course, you can expect a less success rate in the hyperopic group, but again, this is the expectation that you have in these patient population. And as far as safety, then, of course, very few patients lost less than 2 lines, or more than 2 lines or 1 line. So the expectation is that no line loss is pretty good, even though it's not perfect, compared to, for example, the younger population that you're treating that are non-presbyopic age. So in conclusion, then, despite the trend towards worse visual acuity and higher retreatment rates in older populations, a greater risk of visual loss after LASIK was not observed with increasing age. So therefore, LASIK for myopic and hyperopic patients has a reasonable safety, efficacy, and predictability in profiles in the presbyopic age group. So again, you have to sort of adjust as far as the expectations as far as these patients, but still a procedure that's certainly safe and effective in these presbyopic age group, even somebody by the range of groups.